Nifedipine ER Tablet, extended release 24 hours is a medication used to treat high blood pressure and certain types of chest pain. It can help prevent strokes, heart attacks, and kidney problems by lowering high blood pressure. It may also increase your ability to exercise and decrease the frequency of chest pain attacks. However, it should not be used to treat chest pain when it occurs. This medication is known as a calcium channel blocker and works by relaxing and widening blood vessels so blood can flow more easily. Be sure to consult your doctor or pharmacist for more details and to determine the best daily dosage and optimal timing for taking this medication. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the tablets whole. Do not crush or chew the tablets. Doing so can release all of the drug at once, increasing the risk of side effects. Your doctor may gradually increase your dose. Follow your doctor's instructions carefully. Dosage is based on your medical condition and response to treatment. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Grapefruit can increase the chance of side effects with this medicine. Ask your doctor or pharmacist for more details. Use this medication regularly in order to get the most benefit from it. Remember to take it at the same time each day. Keep taking this medication even if you feel well. Most people with high blood pressure do not feel sick. Do not suddenly stop taking this medication without consulting your doctor. Your condition may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. Tell your doctor if your condition worsens, such as increase in your routine blood pressure readings. Some common side effects of Nifedipine ER Tablet, extended release 24 hours include headache, dizziness, nausea, flushing, constipation, leg/muscle cramps, and sexual problems. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. It is also normal to see an empty tablet shell in your stool, as your body has already absorbed the medication. Remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, contact your doctor immediately if you experience swelling of the ankles/feet, shortness of breath, unusual weakness/tiredness, irregular heartbeat, fainting, mental/mood changes, swollen/tender gums, vision changes, severe constipation, severe stomach/abdominal pain, or black stools. While this medication is effective in preventing chest pain, angina, some individuals with severe heart disease may rarely experience worsening chest pain or a heart attack after starting this medication or increasing the dose. Seek medical help immediately if you experience worsening chest pain or symptoms of a heart attack. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed above. Before taking Nifedipine ER Tablet, extended release 24 hours, make sure to inform your doctor or pharmacist about any allergies you may have to this medication or to other calcium channel blockers. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have any heart diseases, liver problems, esophagus/stomach/intestine problems, kidney problems, or a certain metabolic disorder. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. Nifedipine ER Tablet, extended release 24 hours may cause dizziness, especially when combined with alcohol or marijuana, cannabis. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. If you are pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, it's important to consult your doctor before using this medication, as nifedipine can pass into breast milk. While there have been no reports of harm to nursing infants, it's important to discuss this with your doctor before breastfeeding. It's important to be aware of potential drug interactions with Nifedipine ER tablet, extended release 24 hours. Some medications can affect how nifedipine works in your body, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications, such as apalutamide, enzalutamide, and St. John's wort, can affect the removal of nifedipine from your body, which may impact its effectiveness. It's also important to be cautious of products that could raise your heart rate or blood pressure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen and naproxen. Be sure to talk to your pharmacist about how to use these products safely. Now let's talk about the benefits, daily dosage, and the best time to take Nifedipine ER tablet, extended release 24 hours. If you or someone else has taken too much Nifedipine ER tablet, extended release 24 hours and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe dizziness, fainting, and a fast, slow, or irregular heartbeat. It's important not to share this medication with others. In addition to taking this medication, making lifestyle changes such as participating in stress reduction programs, exercising, and making dietary changes may help increase the effectiveness of this medicine. It's a good idea to talk to your doctor or pharmacist about lifestyle changes that might benefit you. While you are taking this medication, your doctor may want to perform lab and/or medical tests, such as liver/kidney function or EKG. It's important to keep all medical and lab appointments and consult your doctor for more details. It's also important to have your blood pressure checked regularly while taking this medication. You can also learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. Make sure to store Nifedipine ER tablet, extended release 24 hours at room temperature, away from light and moisture. It's important to keep it out of the reach of children and pets, so be sure to store it in a safe place. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.